Welcome. This presentation will help you learn more about the changes to the Dallas ISD benefits plans and programs that will become effective September 1, 2015. We will also review how to elect your medical benefits. We're going to start by discussing annual benefits enrollment. Annual benefits enrollment runs for the month of August and is the one time during the year you can make any change to your benefits for any reason you want. There are a few changes to the medical plan, including a new option for the coming plan year, so you'll want to pay close attention to that section. The benefits plan year for Dallas ISD begins September 1, 2015, and continues through August 31, 2016. Once you elect benefits, you may not make any changes for the entire plan year unless you experience a qualified special event and notify Benefits Outlook within the appropriate time frame. Dallas ISD at your service will continue to be your online resource for plan details, costs, and much more. Let's start by reviewing an overview of the annual benefits enrollment, then review what is changing for the 2015-2016 benefit plan year, followed by the benefit options offered by Dallas ISD, and lastly, we'll look at the enrollment process. As with last year, annual benefits enrollment will only occur in August. There is one very big difference for annual benefits enrollment this year. TRS is requiring eligible employees elect medical coverage, even if you already have coverage. Your current medical election will not automatically carry over as it has in the past. You must enroll if you want medical coverage for the new plan year, which begins September 1, 2015. Your elections will be effective at this time and remain in effect through August 31, 2016. Your current benefit selections will automatically roll over to the 2015-2016 plan year, except medical and flexible spending accounts. If you want to continue participation in the FSAs for the new plan year, you must re-enroll per IRS rules. There is one exception where employees will not be required to re-enroll in medical. If you or your dependents have coverage as a result of a qualified medical support court order, you are not required to re-elect medical. Your current coverage will continue to the new plan year. In late July, a benefit statement of your 2015-2016 benefit elections will be mailed to your home. Please check it carefully. If you want to make changes or participate in medical or the FSAs for the coming year, you may enroll online or call Benefits Outlook Service Center during annual benefits enrollment. You are encouraged to enroll as early in the benefits window as possible. One lucky employee who enrolls by August 6 will win an iPad mini. Besides the iPad mini, there are other benefits to enrolling early. First, if you want to have medical coverage for the new plan year, enrolling by August 6 ensures there will be no gap in your coverage. The insurance company will have all of your information in their system by September 1. 2. If you change medical plans or enroll in medical for the first time, enrolling by August 6 ensures that you receive your new ID in early September. And 3, many employees wait until the end of annual benefits enrollment to make changes. Although we plan for this, it's likely that waiting until the end of enrollment will result in having to wait to speak with a representative if you call the Benefits Outlook Service Center. Enrolling early or using Dallas ISD at your service to enroll online are great options to avoid the rush. You can certainly enroll in benefits anytime up through August 31 and have your benefits effective on September 1. But if you need care in early September, you may not have your ID card and the carrier will not be able to confirm coverage. The website is available until 11 p.m. and Benefits Outlook Service Center representatives will be available until 7 p.m. on August 31. Representatives will also be available on Saturday, August 29 and Sunday, August 30 from 8 a.m. to 4 p.m. The Dallas ISD at Your Service website at www.disd dallasisd@yourservice.org is your primary source for the Dallas ISD benefit information. Passwords will be reset on August 1, 2015. The first time you log in to Dallas ISD at your service after August 1, your password will be the 2 digits of the month of your date of birth, the 2 digits of the day of your date of birth, followed by the last 4 digits of your Social Security number. Then you will be prompted to change your password to something only you know. Now, let's take a look at what's changing for the 2015-2016 benefits plan year. TRS trustees have expanded the network for the Scott and White Health Plan to include Dallas County. As all associates work within Dallas County, all benefits-eligible employees may elect the Scott and White Health Plan. This plan is an HMO, so there are a few important things to keep in mind. In network care, you will need to receive most or all of your health care from a network provider, primary care physician, or PCP. Unlike most HMO plans, Scott and White Health Plan does not require members to select a PCP. You have the flexibility to choose any of the network providers. However, you may select a PCP if you prefer. Referrals. You may see any physician in the network without a referral. If you want to see a provider out of network, you will need a recommendation from your Scott and White Health Plan network provider. Out-of-network care. Generally, you will have to pay all or most of the cost for care received out of network. If you elect this plan, you will receive a new ID card. You may search the online directory to confirm if your doctor is in the Scott and White Health Plan at trs.swhp.org. Go to Provider Information. Here is an overview of the new Scott and White Health Plan. There is a deductible that applies to both individual and family coverage, as well as out-of-pocket maximum. As required under the Affordable Health Care, preventive services are fully covered. There are some changes to the out-of-pocket maximum for the TRS Active Care plans for 2015-2016. The new out-of-pocket maximums are displayed in the chart. Remember that beginning last September, deductibles, medical copayments, and coinsurance counted to satisfy the out-of-pocket maximum. Beginning September 1, 2015, pharmacy copayments, coinsurance, and deductibles will also count toward the out-of-pocket maximum. This allows you to reach your out-of-pocket maximum faster. The only benefit that will have cost changes for the 2015-2016 plan year are the medical benefits. All other benefit plans will not change from last year. The district contribution of $303 per month toward TRS Active Care coverage will continue for 2015-2016. Remember, all of the benefits information we are sharing, including contribution rates, plan costs, highlights, and details, can be found in the Common Forms and Plan info page of Dallas ISD at your service. TRS has amended the enrollment eligibility criteria for TRS Active Care to comply with the U.S. Supreme Court's June 26 opinion in Obergefell v. Hodges regarding the legality of same-sex marriages. As a result, a same-sex spouse may be added to the TRS Active Care coverage during annual benefits enrollment. Benefits will be effective September 1, 2015. These plans will not have any plan design changes for 2015-2016 plan year, nor will the costs for these benefits programs change during this plan year. Annual benefits enrollment provides an opportunity to review your benefits and decide if you'll need to make changes. We'll now provide an overview of each of the benefit options. Don't forget, everything you need to enroll is online at Dallas ISD at your service, where you can get plan details, costs, and much more. So let's get ready to enroll. Dallas ISD's medical plan is offered through TRS Active Care and is administered by Aetna. You may choose from 2 preferred provider organization PPO options, 1 affordable care organization option, and a new HMO plan that is administered by Scott and White Health Plan. Or you can select no coverage. Preventive care visits include routine annual physicals, well child care, immunizations, mammograms, or colonoscopies. With the active care medical options, you will have pharmacy coverage through Caremark. Your greatest savings will be mail order for maintenance medications, but you can also obtain your prescriptions at the retail level. You can receive a 31-day supply through retail or a 90-day supply through mail order. The Scott and White Health Plan includes pharmacy benefits as part of the HMO. Generally speaking, a PPO offers more choices than an ACO or HMO in terms of the provider you may see. When you enroll in a PPO, you do not have to select a primary care physician, nor do you have to obtain a referral to see a specialist. You have the freedom of visiting any physician or hospital you choose. A PPO offers 2 levels of benefits, network or non-network. When you seek care from a network physician or hospital, the PPO plan pays a larger portion of your healthcare costs than it pays for services by a non-network provider. When you receive care outside the network, you still have coverage, but you may pay more of the cost. Please refer to your TRS Active Care Enrollment Guide to learn how the TRS Active Care plans work. You may also see plan comparisons on our website at disd@yourservice.org. This chart provides an overview of the deductibles, out-of-pocket maximums, coinsurance, and copayments. You can download the complete 2015-2016 medical plan highlights online at Dallas ISD at Your Service website. Check out the Common Forms and Plan Info section for details on the TRS Active Care medical plan options and all other 2015-2016 benefit costs. Deductibles. The set amount of out-of-pocket expense, if applicable, that must be paid for health care services by the covered person before the plan begins to share costs. For example, Active Care 2 has a $1,000 deductible for individual coverage, which must be met before the plan pays any benefits. Out-of-network deductibles are higher. Out-of-pocket maximum. If you reach your plan's out-of-pocket maximum, the plan then pays 100% of any eligible expenses for the remainder of the plan year. Office visit copays continue after the out-of-pocket maximum is reached. To comply with requirements of the Affordable Care Act, pharmacy copayments, deductibles, and coinsurance will be counted to satisfy the out-of-pocket maximum beginning with the 2015-2016 plan year. This allows you to reach your out-of-pocket maximum faster. Beginning September 1, 2015, this will apply to all TRS Active Care plans. Coinsurance. The percentage of medical expenses that you and the plan share. For example, the coinsurance amount when using network providers for all plans is 80-20. This means that the plan pays 80% and you pay 20% after any applicable deductible. Copayments. The set amount you pay for certain medical services and prescription drugs at the time of service. Note, for Active Care 2 and Select, the copay depends on whether the doctor is primary or a specialist. Primary means care provided by family practitioners, internists, OBGYNs, and pediatricians. All other physicians are specialists. Here's an overview of the prescription drug benefits. For the Active Care 1 HD, 2, and Select plans, Caremark is the pharmacy provider. The Scott and White Health Plan is the pharmacy provider for the HMO. This chart illustrates benefits when network providers are used. Non-network benefits are also available. See the TRS Active Care Enrollment Guide for more information. The Active Care 2 and Select plans provide very similar prescription drug benefits, except the Select plan has a coinsurance of 50% for non-preferred brand drugs. Dallas ISD shares in the cost of your TRS medical plan coverage for full-time employees. For 2015-2016, the district will continue to contribute $303 each month toward medical plan coverage. This chart shows the cost and percentage of the monthly contribution rate that both you and the district pay. It displays the employee-only coverage category. For details about all the medical plan rates, review the TRS Active Enrollment Guide, or you may view the rates on the medical page during the enrollment process on the Dallas ISD At Your Service website. We wanted to take a moment to remind you of some of the features of the TRS Active Care plans. Teladoc provides 24/7 phone access to a national network of physicians for non-emergency medical assistance. Teladoc physicians include general practitioners, internists, and pediatricians. They can diagnose, treat, and prescribe many medications for most common medical issues such as the flu. Quest Diagnostics has agreed to lower lab rates for TRS Active Care participants. The Active Care 2 and Active Care Select plans cover lab services at 100% when using Quest Diagnostics for lab work. Aetna offers the Beginning Right maternity program. Nurses offer free education about prenatal care, preterm labor, newborn care, and more. This has been a summary presentation of the Dallas Independent School District Benefits Program. In case of errors, omissions, or disputes between this presentation and the carrier benefit contracts, the carrier benefit contracts will prevail. Benefits are subject to change, and the Dallas ISD Board of Trustees reserves the right to terminate any program as deemed appropriate. You may contact the Benefits Outlook Service Center at 866-840-DISD or 3473 for any questions. Representatives are available weekdays from 7 a.m. to 7 p.m. Thank you for watching, and we hope you found the presentation helpful in preparing for annual benefits enrollment.